herpes! But just so we're clear, today we're talking about cold sores. They're a pain, we all get them, but we're going to talk about what causes them and how to treat them. Hey, I'm Dr. Laura Soong, board-certified dermatologist. Welcome to my channel where I talk about all things related to skin and dermatology. If you're new here, make sure you subscribe to my channel and hit that notification bell so you don't miss any of my future videos. So there's two different types of herpes virus infections that most of us know about. There's HSV1 or herpes simplex virus type 1, which causes cold sores. And then there's herpes simplex virus type 2 or HSV2, which causes genital warts. We're going to focus today on HSV1 or the cause of cold sores. To be clear, this video is not about genital herpes. I'll make another video about that. Cold sores are caused by HSV1, which is a virus, and it's transmitted by direct contact with an infected person. For example, by kissing someone who has the virus. It starts out as what we call a primary infection, which can be asymptomatic, meaning you have no symptoms, or you can get a really bad outbreak in your mouth where you get sores all over the place, sometimes affecting the tonsils or the back of the throat, and you feel really crummy with fevers, swollen lymph nodes. Then it establishes what we call latency in the skin. And so it infects your nerves and travels down that nerve in the skin and hides there for the rest of your life. Then, due to certain triggers or things like stress or low immunity, the herpes virus can make a comeback and cause what we know as a cold sore, usually in the same place because it's connected to that nerve that then innervates the skin. Certain things can trigger cold sore outbreaks. Common things are UV exposure or sunlight, menstrual cycle changes, stress, and low immunity. So for example, if you're really sick. Cold sores have a pretty classic appearance. So they show up as these small grouped blisters, usually around the mouth, and then they crust over and dry up into these bloody little scabs. It's often preceded by what we call a prodrome. So you might notice some tingling or burning type sensations before the little blisters show up. It's usually pretty self-limited, meaning that it just resolves on its own if you were to do nothing. So a typical cold sore outbreak usually lasts between 1 to 2 weeks and then heals up on its own. If you're ever unsure if you have a cold sore, then see a dermatologist. We typically will do a swab of the cold sore to confirm. Here's some things that you can mistaken cold sores for. Bacterial infections on the skin, such as impetigo, canker sores, which are usually inside the mouth, cuts and bruises from shaving or some sort of irritation, and sometimes even skin cancer can mimic cold sores. It can also sometimes be mistaken for something called angular cheilitis, which is like an irritation or cracking problem along the corner of the lip, or allergic or irritation reactions along the lip margin. There are some treatment options for cold sore outbreaks. First, I want to emphasize, though, there's a lot of fluff and a lot of garbage out there that tries to scam you, claiming that there is a product that can cure cold sores or herpes. There is no cure. Over-the-counter products that you can try to expedite or speed up the healing of your cold sores would be things like Abreva, which prevents the cold sore virus from spreading to nearby skin cells, or something like L-lysine, which just helps to heal it. You can also use products like Vaseline or even cold sore patches, which just provide a protective barrier so that the skin is able to heal faster. There are some prescription products as well. We usually prescribe something called an antiviral medication. So examples would be valacyclovir, acyclovir, famciclovir, and you basically take these pills for a period of time to help shorten the duration of the infection and speed up healing. The way that these medicines work is they prevent the virus from replicating too much, but they don't actually get rid of the virus from your body. The virus is still in your body and stays in your body for the rest of your life once you catch it. In terms of the antiviral medications, there's something called episodic dosing, where if you know that you're getting an outbreak, like you get that tingling sensation, or you can feel it coming on, you basically take the medication at the first sign of the infection, and that does help to shorten the outbreak and reduce the severity. Some people, if they get very frequent outbreaks, like once a month or over 6 times a year, then we can prescribe something called suppressive dosing, where you take a low dose of an antiviral pill every single day to prevent the cold sore outbreaks from happening at all. Topical therapies have some evidence that they help, but you have to apply them multiple times a day, usually at least 4 or 5 times a day, and they don't work as fast as the pill version of the medication. You also have to start the topical products at the first sign of the outbreak, like before you even see the blisters, for them to work properly. You can still use them when you have the active blisters, it's just not going to work as well. If you're struggling with a bad outbreak and you're finding it's very painful, a few things that you can try is using a numbing agent like lidocaine on the area where you have the cold sore before you eat, for example. To prevent cold sore outbreaks, it's really important to manage your stress and take good care of your body. Things like not enough sleep, not enough hydration or drinking enough water, poor diet, all those things can trigger outbreaks. So focus on self-care. The other thing you can do is make sure you protect your lips from the sun. So getting a good SPF 30 or higher lip balm to put on regularly when you're outside. And like I mentioned earlier, if you struggle with frequent outbreaks, you're getting them all the time, chat with your doctor about getting on that suppressive antiviral medication. So what if you have an active cold sore? Don't let it dry out, okay? You want to keep it nice and moist by putting Vaseline petroleum jelly on it multiple times a day as a protective barrier, or use a cold sore patch. Wounds heal best when they're left alone, so don't manipulate it, pick it, or pop it. Now here's a warning. The cold sore virus is spread, like I said earlier, by direct contact. So if you have an active cold sore on your lips or your face, you could spread it by kissing someone else. You can also spread it by sexual contact, so I would recommend you avoid any type of oral sex while you have an active blister. Well, that's it for this video. If you're struggling with cold sores, know that there's a way to prevent them as well as ways to treat them. If you like this video, give it a thumbs up and stay tuned for more.